Ladies and gentlemen, today I will discuss about a big problem about mandatory vaccination for all eligible individuals. The issue at hand is growing resistance towards vaccination, which poses a significant threat to the public health. It is crucial to address this problem by implementing mandatory vaccination, that is, policies to ensure the well-being of individuals and protect the community from devastating consequences. My name is Milky, and I am here to represent a comprehensive case for this policy change. The resolution at hand is unequivocal. This House supports a mandatory vaccination for all eligible individuals. For the purposes of the discussion, I, and the proposition team, we define mandatory vaccination as a policy that requires all eligible individuals to receive certain vaccinations as a condition for accessing public spaces, services, education. This policy is based on the overwhelming scientific consensus that vaccines are safe and effective in preventing the spread of infectious diseases. By implementing mandatory vaccination, we can significantly reduce the risks of outbreaks and protect vulnerable populations such as infants, elderly individuals, and those with compromised immune systems. Mandatory vaccination policies have been proven to be effective in increasing vaccination rates and also reducing the incidence of vaccine-preventable disease, which can be prevented using vaccine. Studies have shown that countries with higher vaccination rates have lower rates of diseases outbreaks and associated details. For example, a study published in the Journal of the American Medical Association found that implementing mandatory vaccination policies for children significantly increased vaccination coverage and led to a decrease in vaccine-preventable disease. Why? Also, to support this additionally, a review of multiple studies that are in the World Health Organization, WHO, concluded that mandatory vaccination policies are a crucial tool in controlling and eliminating vaccine-preventable diseases globally. These scientific sources provide strong evidence for the effectiveness of mandatory vaccination policies in reducing the risk of outbreaks and protecting vulnerable populations. So why not add this policy? There are some of the evidence that shows why. Additionally, a review of multiple studies conducted by the World Health Organization, concluded that controlling vaccines and mandatory vaccination policies are a crucial tool in controlling, eliminating vaccines-preventable disease globally. These scientific sources provide strong evidence for the effectiveness of mandatory vaccination, which I have already repeated. If this policy isn't adopted, then what happens? That is. The impact on this is that failing to address the issue of low vaccination rates can have severe consequences. Not only does it increase the likelihood of outbreaks, but it also puts vulnerable populations at greater risks than ever. They are at greater risk of suffering from vaccine-preventable diseases. This can also lead to increasing healthcare costs, strain on healthcare systems, and unnecessary suffering and deaths. Therefore, implementing mandatory vaccination policies is crucial in order to mitigate these risks and ensure the safety of communities. So now to my argument second. Mandatory vaccinations policies can help protect individuals who are unable to receive vaccines due to some medical reasons, as those with compromised immune system, as I've already said before, or allergies. Have you ever experienced an allergy? Are you allergic to peanuts, fish, eggs, or even water? Those people have some compromised immune systems and allergic diseases, conditions that they cannot have a vaccine. They cannot be vaccinated. By ensuring that a high percentage of the population is vaccinated, it creates a concept known as herd immunity, where the spread of infectious diseases is significantly reduced, indirectly protecting those who cannot be vaccinated. This not only benefits individuals, but also helps maintain the overall health and well-being of the society as a whole. So how does this work actually? Imagine the world has 10 people. This is only imaginary. 9 people has been vaccinated, but 1 is allergic to vaccination. To vaccine, that is, and they can't be vaccinated. But the whole world only has 10 people, but 9 people have vaccine. They have been vaccinated already. So in case if the virus comes, well, they cannot infect the vaccinated person. But what about the person that hasn't been vaccinated? Why? Okay, so if all of the persons are vaccinated, the virus will have to be in the objects. They have to stay in objects. And those people, probability a 1, a 9 out of 10, that the vaccinated people touches that object. But the virus cannot spread into it. Slowly, the virus will die. This not only benefits individuals. Sources supports the effectiveness of vaccines in preventing the spread of diseases and reducing their severity. For example, studies have shown that widespread vaccination against diseases like measles have led to wide and outrageous decreases and even eradication in some regions. That is the impact and the effect of the vaccination policies. Additionally, vaccination have been instrumental in controlling and also preventing outbreaks of deadly diseases such as polio, smallpox. Organizations such as the World Health Organization (WHO) and the Centers for Disease Control and Prevention (CDC) promote and advocate for guidelines and recommendations based on extensive research and scientific guidelines. Also, evidence to ensure the safety and efficiency of vaccines. Furthermore, peer-reviewed studies published in medical journals consistently support the use of vaccines as a crucial tool in caring for public health. In conclusion, the resolution stands as a call for action, for more global action, for a more comprehensive approach to vaccination. It highlights the importance of collaboration between government, countries, healthcare professionals, and communities. Us, we are communities. If we join hands together, then we can make this policy happen. Everything will be just great. We can prevent the spread of infectious diseases, protect vulnerable populations, and ultimately save lives. As a society, it is our responsibility to stay together, to work together, and to ensure that vaccines are readily available and accessible to all individuals, regardless of their socioeconomic status. Societal economic status or geographical location, whether they're in the North Pole or in the Sahara Desert. This can be achieved through the establishment of our joining hands and of our healthcare systems, the allocation of sufficient resources towards the production of vaccines and distribution of vaccines. Additionally, continuous research and development in the fields of vaccines have led to numerous discoveries of new and improved immunization methods, further enhancing our ability to combat infectious diseases effectively. Well, that is all of my speech. Do you ever wonder why many people has a bad feeling about vaccines? Some people wonder how vaccines are made. Also, people wonder, well, how does vaccine works? All those will be explained in my next video. But for now, thank you for listening and watching me. Please subscribe to my channel.